We're here at Faith Regional Health Services today to talk to an orthopedic nurse navigator to learn more about what she does for her patients. I'm joined here by Kathy Steffensmeyer. And Kathy, you're an orthopedic nurse navigator. Can you tell us what that means?
An orthopedic nurse navigator works with patients to just basically educate them before surgery and then also help with discharge planning to get them ready to return home after surgery.
So when you say you're educating these patients, you're talking like an actual class, you're actually teaching them?
Yes, we do have once a week on Mondays we have orthopedic class that we teach patients for hip and knee scheduled surgeries, and where we educate them about what to do to get ready for surgery and how to be successful. Also to understand their hospital experience, what's it going to be like, and then work on discharge planning and confirm their plan.
So an orthopedic nurse navigator works as a resource. Can you kind of talk about, you do the class beforehand, what about maybe day of and after the surgery? What are some things you're doing for the patients?
And even, I'll back up, even before the class, I do a phone call to just do kind of an assessment of how are you functioning before surgery, what is your home setup like, and then we talk at the class and do the education. And then the day of surgery, when they're in the hospital, then I work with the hospital team to make sure they know our discharge plan for the patient. And then I also round on the patients the day after surgery and go through a lot of information to be successful at home. And then just make sure that I'm a resource after surgery for up to 3 months. So that involves one or more phone calls when they get home, just to make sure they do understand their medications, their activity, and just make sure sometimes they need somebody to encourage them to keep working on their home exercise program, or to encourage them that they're doing what they need to do.
Well, any procedure in surgery is obviously a big deal. It can be overwhelming to people. So thank you for walking us through how you kind of help ease it for people and make it as simple of a process as possible.